Ladies and gentlemen, we now have the privilege to announce and honor the 2022 Stephen Schroeder Award for Outstanding Healthcare CEO. This is an important award that recognizes a leader in healthcare who truly puts patients first by prioritizing the twin issues of quality and affordability. This is a joint award between the Leapfrog Group and Costs of Care. To present the award, please join me in welcoming to the stage Chris Petrilli, Director for Costs of Care and an Associate Professor of the Department of Medicine at the NYU School of Medicine, and Leah Binder as well. Come on up.
Great. All right, thank you very much. It's a great pleasure to be here. For those of you who are not familiar with Costs of Care, we're an NGO whose mission is dedicated to building a pipeline of change agents that will hopefully lead to the creation of a more affordable and equitable healthcare system. Sorry. Oh. Sorry. For those of you, the Leapfrog Group has been an incredible partner for us. They are, as you know, they are leaders in assessing quality and safety across hospitals across the country. And now we are thrilled that Leapfrog is increasingly looking at affordability through their financial ethics scorecard. Because as Leah always says, affordability is a quality issue. At Costs of Care, we launched the Affordability Moonshot in December of 2019. And partnering with organizations like the Leapfrog Group, and being able to recognize leaders in healthcare with the Stephen Schroeder Award give us hope for a better future for our patients so that no one has to choose between their life and their life savings. We're sorry Dr. Schroeder couldn't be here today, but for those of you who are not familiar with him, he's been working on improving costs of care for about almost half a century. He trained at Harvard Medical School. He founded the Division of General Internal Medicine at University of California, San Francisco, where his research was really focused on cost effectiveness, accessibility, and affordability of care. As president of the Robert Wood Johnson Foundation, he advocated for expanding health insurance coverage and was really a true leader of this work. And this award is named in his honor and is meant to highlight leadership practices that represent the ideals of improving the dual mission of affordability and safety. By spotlighting these good examples, we hope will inspire all of us to do more to take better care of our patients. So it gives me great pleasure to introduce the winner of the award, Dr. J. Stephen Jones, President and CEO of iNova Health System, Northern Virginia's nonprofit healthcare system. So Dr. Jones really embodies all of the ideals for this award. He set the strategic agenda for iNova to focus on initiatives that propel his system toward their care mandate to best meet the clinical, operational, and financial goals for the system. iNova's costs have historically been lower than other health systems and hospitals in the region. This allows them to invest in patient care rather than overhead, and also in part allows him to provide the highest percentage of charity care in the whole state of Virginia, which is over 400% of the federal poverty guideline income. He works tirelessly to ensure that his patients have greater access to high quality, affordable care, and under his stewardship, iNova Fairfax has expanded their free care clinic network for those patients who cannot afford regular medical fees. iNova now also has a food pantry in all iNova care clinics to address food insecurity in addition to providing affordable care. And Dr. Jones works with other large health systems across Virginia outside of his geographic catch area, and he educates them on how to implement free care clinics in their areas. Additionally, iNova's Partnership for Healthier Communities identifies uninsured children and adults and connects them with appropriate and affordable source of quality healthcare services through programs like Medicaid and CHIP. And since the inception, that partnership has enrolled more than 45,000 Virginians in Medicaid. So without further ado, please welcome me and Please join me in welcoming Dr. Jones to come up and say a few words. Dr. Jones. These over here. Great. Thank you.
Thank you. I just have to say, I truly am honored and humbled to accept this award, but to accept it on behalf of over 20,000 team members at Inova. At Inova, we've had a long history of focus on quality and safety well before I became CEO. Inova Loudoun Hospital is one of only 22 hospitals in all of America to be recognized by Leapfrog as straight A since the inception in 2012, and the only one in Greater Washington. But we're far more proud of the fact that every hospital is straight A since 2018. Every Monday morning as I onboard new team members, I tease that straight A never gets old. But we know that straight A happens based on relentless focus on quality and safety. And not just for our patients, but for our team members. COVID made clear why safety of team members matters even or just as much. So we prioritize now psychological, physical, and social safety as a workplace. Our unofficial tagline during 2020 literally became "Safe at Inova." How did that manifest? Even though we had a local COVID surge literally days after the initial surge in New York, there was not a single day where our team members were unprotected with PPE. Yes, we begged, borrowed, didn't steal to protect our team members, but it worked. We also began masking while all official recommendations pushed for us not to. The science was not clear yet, but we knew we were committed to doing everything we thought would keep us safe at Inova. And I'm aware of only 2 health systems to put a true mandate as a condition of employment without a test-out option for COVID-19 before Inova. And I know of only one that mandated boosters before we did. The explanation was straightforward: safe at Inova. And while others feared doing so would lead to mass resignations, we were convinced that more caregivers would actually want to work in a place that focused on their and our patients' safety. Yes, we had a small number of valued team members choose to leave, but I'm convinced our record hiring levels and improving retention now are directly related to knowing we keep our team members safe at Inova. Inova lives by what we call our care mandate, to provide a people-centered, high reliability, high value, seamless system of care. Those in this room today know the high reliability part as quality and safety. Obviously, we embrace those, but also the seamless system of care requires equitable, accessible care. Inova Cares clinics were created to care for patients underserved by primary care and women's services in our community, and we just opened our first one dedicated to behavioral health. Inova Partnership for Healthier Communities has enrolled over 45,000 Virginians in Medicaid, and it was praised for ensuring access to all during an August visit by HHS Secretary Becerra and CMS Director Brooks LaSure. But access is only one step towards equitable outcomes, focusing on social drivers, not determinants, but social drivers of health with an honest assessment of outcomes is our current work. For example, our data demonstrate we have equal and very low risk of maternal mortality in our system, but we don't have equality yet in C-section rates. So we're working diligently now to understand and address this to assure that every patient has accessible and equitable care. You have my commitment to getting this right as well. Our team remains relentlessly focused on delivering affordable care for all of our patients. You heard a touch of that. Inova provides over 70% of the total charity care in our region, and I'm unaware of anyone who has a more generous charity care policy anywhere, writing off 100% of charges for all services for anyone below 400% of the federal poverty level, which is a family income of 4 of over $100,000. We also do everything in our power to determine presumptive charity, using technology and publicly available data to assess whether or not the patient qualifies. We monitor to make sure no one falls through the cracks, and so far I've been unaware of anyone who has. But if we miss, then we'll correct that with a presumption of eligibility. Like Leah, who transformed this discussion over a decade ago, the entire Leapfrog organization, cost of care, and Schroeder, for whom this recognition is named, Inova is committed to serving our community and providing safe and affordable care to each patient we're privileged to serve today, tomorrow, well into the future. I appreciate very much the honor of accepting this award today. Thank you.